Hi everyone, it's Emma here, and this week I'm discussing how do you stop PMS, breast tenderness. So I think the breast pain can be a fairly common symptom of PMS in many cases, and how we can kind of determine if it's likely to be linked to PMS is the patterns that we might notice in our symptoms. So we call this cyclic or cyclical, and nostalgia is the official name for the breast pain. So when we say cyclic or cyclical, that means that you tend to get symptoms around the same time each month. So quite often this occurs, and the reason why we're getting this pain is due to change in hormones at certain times of the month. So quite often, in some cases, we can get breast pain around the time of ovulation. That's around the middle of our cycle as estrogen rises. But more often than not, it's actually progesterone, which we assume is actually driving this symptom. So in the second half of your cycle after ovulation, estrogen levels go very low and progesterone levels high, are fairly high, but certainly high in relative to the estrogen. And it's this progesterone, the high progesterone, which can potentially cause your milk glands to swell. The glands in your breast tissue can swell slightly, and that's what can give rise to this heaviness, the achiness, the pains, even sometimes sharp pains, and sometimes even just your breast feeling a little bit lumpier than usual as well, although it's important to note that these symptoms are often quite short-lived, and then especially when you get your period, your estrogen levels start to rise, and usually these symptoms will start to dissipate. Sometimes we can get it near our lymph nodes as well, so that's more under our armpit. Again, these changes can be driven by hormonal changes. So again, the key is if they're cyclical and they're quite short-lived as well. But that's just helping to explain a bit about why we actually get that tenderness. High prolactin can be another hormone that can potentially contribute to the breast pain. That quite often goes hand in hand with high estrogen. So when we talk about the estrogen dominance, and then if we're quite estrogen dominant, but then we might get that fall off in estrogen during the second half of our cycle, and that might be even more apparent, even more extreme if estrogen was quite high to start with. So that's just another reason just to consider if you're interested in some of the likely causes. So now moving on, what can be done to help? This is what I'm sure many of us are wondering. So I'm just going to nip through some diet, lifestyle and supplement options that can hopefully help to relieve some of that pain and discomfort around the breast. So number one from me, there's a common theme, is to keep hydrated. This helps nearly every system of your body, but it's particularly important for helping to keep your individual cells and glands nicely hydrated, nicely moist. And also your hydration has a lot to do with your electrolyte balance in your body as well. So this is where salt can come in as well, that if we have too much salt in our diet, this can potentially throw your potassium levels off, and that can directly affect the hydration of every individual cell in your body. So we really want that delicate balance to be maintained. So drinking enough water, not consuming too much salt, and also having enough potassium and magnesium in your diet can all help support your hydration status and your electrolyte balance. Potassium and magnesium are mainly found in your fresh fruit, vegetables, nuts, seeds and things. So it's just all about that fresh whole food diet. Number two for breast pain in particular, and also any pain or cramps as well, is to apply some warmth. So I talk a bit about this, about why exactly this is happening from a physiological point of view, and that your pain receptors fire off when we feel pain, but we can actually replace that with heat. Your heat receptors can become more dominant if you apply some heat, and that means that you feel the heat rather than the pain. Some people prefer heat versus cold, so alternating between heat and cold, or just the heat. My preference is the hot water bottle, the heat, and just obviously making sure it's not too hot against your bare skin. So if you have a hot water bottle, or wrap a few layers around first, just to make sure you're not burning the skin at all. Number three is a bit of a more practical point, is about comfort in terms of your bras. So I think the majority of women actually have ill-fitting bras. I know I'm guilty of it. It's a very common thing. So to get your bra checked, and then there might be some specific types such as sports bras, which are particularly centered around comfort at that time. Of course, we want you to continue to be able to keep moving, living your day-to-day life. Exercise is going to be very beneficial in general for supporting your circulation, even helping your bowel movements being more normal, just that gentle, regular movement that we always talk about. But it might be at this time more than ever that we're quite conscious of our breasts. If you're exercising, might be a little bit uncomfy, feel a bit heavier than normal. So just trying to consider if you could get a better fitting bra and something just to offer you that extra support during that time. Next, I'm talking about caffeine and just some other dietary elements that might be particularly relevant when it comes to breast pain. There has actually been research around calcium and caffeine in particular. Caffeine's quite pro-inflammatory in the body, so it could potentially add to feelings of discomfort. Coffee, for one, people might have read coffee can be good. In terms of the caffeine content, because it's so high, that tends to outweigh any benefits. And what I would say is potentially coffee can be good in terms of the antioxidant content, but we can get antioxidants elsewhere in our diet. So lovely green teas if we're thinking about drinks, and colourful foods, eating the colours of the rainbow, lovely vibrant berries and green leafy vegetables, and we can get antioxidants that way to help. Vitamin E is another antioxidant. It's a fat-soluble nutrient that is quite often thought to be beneficial for symptoms of pain and sporting nice skin and things. So vitamin E is another one that we can get from healthy oils. And that's actually my next point as well on the subject of healthy fats or oils, is to add in omega-3. This has also been associated with helping improve periods pain, so cramps themselves, but also breast pain. There has been research around that, and there's been mention of flaxseed in particular. So milled flax seeds or flaxseed oil are a lovely source of omega-3. Omega-3 is anti-inflammatory in the body, and that can potentially help to relieve some of that discomfort. Also, we need to have enough omega-3 relative to omega-6, and especially in the Western society we quite often have too much omega-6, and that comes in the form of low quality, poor quality fats and oils such as your mass-produced vegetable oils and things like that. So there's quite often the suggestion as well that evening primrose oil could be beneficial. My personal opinion, and in light of some of the research on EPO, evening primrose oil, is a bit more debatable, I would say, and that for me is linked to that ratio of omega-6 to omega-3. We generally have far too much omega-6, whether or not it's the better quality evening primrose oil source. So for me personally, I would just stick to your omega-3. The research is much more favourable, and it makes sense that in most cases we need to up our omega-3 relative to that omega-6. Magnesium is another nutrient that could be helpful here. Magnesium is very important for helping us to manage our pain, to reduce our pain threshold, pain sensitivity, up your thresholds, but become less sensitive to pain. And it's another nutrient that is commonly depleted. So caffeine, stress, processed foods, these medications is the other one, especially the pill actually. These will all deplete your magnesium levels, and also for not eating enough fresh foods, and that's exactly where we have to get enough magnesium, where we get our magnesium, where the source is. So for me, definitely prioritise those food sources of magnesium. And then also you could add in an extra magnesium source, such as with something like our balanced mineral drink, and that's got your key nutrients in there, including options like vitamin D, magnesium, calcium, potassium, zinc, or you can just get a standalone magnesium. But for most people, I would say they could benefit from extra magnesium, whether or not it's particularly from breast pain, but that's certainly relevant right now as well. Number 7 is talking about a specific hormone regulating supplement option, which is your Agnus castus. So this is licensed for symptoms of PMS including breast tenderness. Now, what I would say with the Agnus is, first of all, you can't take it if you're on any hormonal medications, but I would also just say to consider your symptoms as a whole. Generally, Agnus castus can help with the hormone imbalance that's associated with breast tenderness, but I wouldn't usually say just to take it for that symptom alone, usually if it's in combination with a number of symptoms, so including your painful, heavy periods, irritability. These are the symptoms that the Agnus castus is licensed for. But if you're ever in any doubt if this remedy is suitable, please always do get in touch. So I'm just wrapping up here just to finish saying that, of course, with breast pain, any breast changes, especially if they aren't that cyclical, so if they're lasting for longer than just that time of the month, if there's any severe, persistent, unusual symptoms, any changes to your nipples, any lumps that aren't going away, ever in any doubt when it comes to breast, of course, we would urge you to go and have that checked with your doctor just in case. So just a little disclaimer there. Also, I would say that they may, depending on your symptoms and depending on what they diagnose, that medications may be necessary depending on your symptoms, but also consider if you're already on any medications as well, including hormonal contraceptives. We know that this symptom is quite often related to hormones, so if you're already on medication that is purposely influencing your hormones and you're getting symptoms that aren't working well for you, then it absolutely makes sense to be discussing this with your doctor anyway, and they could perhaps change the dose or the type of medication that you're on. So hopefully that helps everyone. As always, please ask any questions below. Please do subscribe to our Evogo YouTube channel and also hit the bell icon where you'll be notified of any future videos.